Welcome to the PIC Family Voices podcast, a space for families of children and youth with disabilities and special healthcare needs and the dedicated professionals who support them. Join us as we dive into topics from early childhood and healthcare to education, behavioral health, and life after high school, everything that shapes our shared experience. Our mission is to equip you with the insights, resources, and a supportive community to help you navigate this journey in ways that work for you, your family, and the people you care about.
Welcome back to the Healthcare Transition Matters podcast. My name is Ansley Peacock, and I'm the Transition Initiatives Coordinator for New Hampshire Family Voices and the Parent Information Center. I'm here today with two wonderful members of the YAG Council. The YAG Council stands for Youth for Education, Advocacy, and Healthcare. The members joining me today are Abby and CJ, who are both college students. Today we're talking about healthcare transition from the youth perspective. So Abby and CJ, if you had a friend who'd never heard of healthcare transition before and who may not be familiar with their chronic, complex health conditions or disabilities, how would you explain it to them? CJ, let's start with you.
It's like any other type of transition to adulthood, like independent living. If your parents teach you how to do chores on your own and help you look for an apartment, um, then by the time you actually move out, you'll be ready to live by yourself. You'll be able to do your own laundry and cooking. You'll know how to pay rent and do maintenance. You'll also know when to call someone for help, like if you need to call the electrician. Versus if you just get dropped outside and told to find a house the day you turn 18, you're going to have a way harder time. So it's the same thing with healthcare transition. If you're taught how to be independent in your healthcare and medical concerns step by step as you get older, then by the time you are ready to be relatively independent, you're going to be capable of it, and you won't just be surprised and dropped out on your own.
I love that explanation, CJ. Thank you so much for framing that for us. And it's just like every other transition that teenagers, young adults go through. How about you, Abby? What is healthcare transition like? How does it show up for you?
For me, it's taking more responsibility and control over my health and more autonomy. With by having more responsibility but still having some support, like with a supported decision-making agreement, or an SDM. You get to choose the people in your circle of support to be helpers. They can be friends, family, support professionals, to help make decisions and big life choices, but the choice still stays in your control.
That's wonderful, Abby. Thank you so much for telling us about supported decision making. And I think that it's a wonderful tool for young adults to be able to use if they still want some support in areas, but you're
Yeah.
right, the control stays with them. That's great. What is something that has helped each of you with your own healthcare transition journey, like learning different parts of it? CJ?
I did a kind of doctor by doctor process as my plan for learning all of my health stuff. I started with the doctors where I really wanted to be independent, like the OBGYN was the first one I did because I didn't want my parents there. Um, so I started with learning my health history in that area, how to make appointments for that, and how to go to the appointments by myself. And then went with all of the different specialists I see, and I'm still working on that. For example, the dentist, I'm not too concerned about doing by myself. My parents are able to help me with that, and I'm fine with it. So I'm waiting to figure out all of dental insurance and all of that uh, until I get there, which will be later. But I'm still able to do a lot of my medical stuff by myself right now.
I love that example, CJ. Thank you so much for like showing that spectrum of support and how starting with one doctor that you want to be more independent with and leaving the others for later is possible. How about you, Abby? What's something that's helped you on your healthcare transition journey, like learning different parts of it?
I've been working med by med, and I've had great teachers because of New Hampshire Family Voices and my mom support people. Um, I've learned it in chunks. I'm putting a medication list together, a doctor team, and a community provider team. I'm putting together a medical summary in my own format and my own words. It can be overwhelming when you have a complex case, so don't feel alone if you have a complex case or many diagnoses.
Yeah, it was definitely overwhelming for me too, but it also helps a lot to break it down into manageable pieces.
I adore that you both shared that. And Abby, thank you for sharing. Like it went medication by medication for you. For some youth with chronic health conditions or disabilities, it's like they might have one med. Like, let's say if you're diabetic and you use insulin, but for more complex cases, you might have 17 medications to take in a day. So, for youth to learn those meds, it's not necessarily a one time simple goal. And so, I so appreciate you both speaking to it can feel overwhelming and how to break it down into manageable pieces. That's awesome. Um, so, with the work I do with healthcare transition and supporting like healthcare coordinators who support teens who are going through the healthcare transition process, sometimes I hear an example goal of a youth will become medically independent. In other words, be able to do all of the things all by themselves. Do you think that's realistic? How about you, CJ?
No, because no one is completely independent ever. Like to have food, you can cook by yourself, but you still have to go to the grocery store to get food that other people grew. Or if your car breaks down, then you're gonna have to get an Uber and a tow truck, and rely on those other people to help you. In the same way, if you have a health flare up or you have a big change in your routine, you're gonna need more support than you would otherwise. Um, so, and often the most efficient and just the best way to get things done is to have help and to rely on the people around you. We're all, interdependent.
Interdependence. That's such a good word, CJ. Thank you for bringing that point up. You're right. If I need my taxes done, I go to a CPA. If I need my car worked on, I go to a mechanic. None of us do all of the things all by ourselves. Abby, what do you think?
I'd love for that to be the case, but it's not. Um, it can depend day by day, energy levels, fatigue levels, my mood, so I can use my tools to help me be successful. And it's all about having a plan to get things done, knowing what tools to use in what situations, whether it be graphics, spreadsheets, or reminders.
Yeah, really what's important is being able to make the choice to ask for help and being able to take on part of the responsibility or all of the responsibility, depending on what's possible for you, of knowing who and how to ask for help. So, like if you have a regular visit, you might be able to do that on your own. But if you have like your wisdom teeth out, you're gonna need support. You're gonna need someone to drive you home. And different people will have different thresholds, but the most important part is that you're the one making those choices in the end in an independent way.
Yeah, thank you so much for that perspective. That's a far more realistic and achievable like goal is having young adults or youth figure out where they need support, what that support is, and how to ask for it because we all need support depending on the day. I really appreciate that. For each of you, you are college students and starting to move towards those later stages of transition, what's next for you on your healthcare transition journey? CJ, let's start with you.
So for me, I have two things really. Firstly, I want to know enough about my health to be able to make informed decisions. So I want to know about my health history and about how the body works so that if a doctor recommends something that doesn't fit with my personal health history, I can bring that up and ask them to double check. For example, one time I got prescribed a medication that wasn't good for people who get migraines, and I do get migraines. Um, and although I didn't notice it at the time, I think now I would be able to bring it up like, hey, I don't know if you saw, but in my chart, I get migraines. Can we double check if that interacts with this medication at all? And the other part is that I want to be able to get through my daily life with the minimal amount of struggle. So that includes not only being able to do my daily tasks, but also having a bit of extra energy to do fun stuff like have hobbies, which is really made possible through accommodations and mobility aids and medication, which are all the things that allow me to live a normal life.
That's such a great answer, CJ. And I'm so appreciative of you bringing up how, those accommodations, mobility aids, and medications, they allow you not only to get through your day, but to have energy at the end of the day to then do some fun things on top of those daily need things. And just those are two great goals for you. How about you, Abby? What's next for you?
Created my own login on both of my healthcare portals, and I'm having more decision-making control, autonomy, and choice now and in the future. This is why I'm doing all the work I'm doing with learning my medical history, medications, in a way that benefits me, and developing tools. And I can relate to CJ with the energy need shifting and processing sensory overload and using tools to help balance that.
That's great, Abby. Congratulations on taking on more responsibility in your healthcare with those logins. And I love that you're balancing that I get autonomy and choice if I'm willing to take on more of that responsibility. And you've been working really hard on making those tools and learning your health history in a way that you can then speak it to professionals, medical professionals, in a way that makes sense to you. I want to thank both of you so much for giving your time and all of the practice that came to making today possible. As a young woman with a disability, I would have adored hearing this when I was your age. So thank you so much for sharing all of your insights today. To our listeners, I hope that you've enjoyed hearing from these wonderful YA Council members and that you will join us next time on the Healthcare Transition Matters podcast series. Have a great day, everyone.
Thanks for tuning in to the PIC Family Voices podcast. If you found this episode helpful, be sure to subscribe and leave us a 5-star review. It helps us keep bringing valuable resources and stories to families like yours. Until next time, take care.